In today's Women's Care Wednesday, Dr. Maya Kamath from Women's Care Florida joins us to discuss uterine fibroids and if we should be concerned about them. Well, as I'm already spending time with the doctor, I'm learning more and more. Welcome to the show. How are you?
I'm good. How are you?
I am well. Thank you. So, uterine fibroids, one of those things where I feel like I've heard the term, but to be quite honest with you, I'm not 100% sure what it is and who it affects.
Sure. So uterine fibroids are actually quite common. About 70% of women will develop at least one fibroid by the time they're 50 years old.
Wow.
And usually they don't cause people problems, but sometimes patients can have pain, bleeding, and pressure symptoms from them.
What matters if like a patient is affected versus a patient that is not necessarily affected and might not even realize they have them? Is there certain characteristics you see?
So generally we see patients come into the office complaining of heavy menstrual cycles or having pressure symptoms, something pushing on their bladder or their rectum, or sometimes they'll complain of pain.
And then that's when you kind of begin the diagnosis.
Exactly. So we would run an ultrasound to see if they have fibroids. Sometimes we can pick them up on exam as well.
Okay, I wondered if it was going to be something invasive, but neither one of those things are too invasive.
No, not really.
So surgery is not required for diagnosing, or?
No, it is not required for diagnosing. Generally, patients that don't have very many symptoms, we usually monitor them. Sometimes we will put patients on medications like birth control pills if they're having a lot of bleeding. If they are having pain or other symptoms, then sometimes they have to be removed surgically.
Okay, and that's where I'm glad you're talking about the symptoms and what needs to happen. So if someone has no symptoms, might not even know, but when you do see that, let's talk about what are some other treatment options, or is that the only one?
Usually it's medication, surgery. Sometimes they could also do a procedure called a uterine artery embolization or a fibroid embolization, which is basically a non-invasive way to shrink the fibroids. If we do conservative management, it doesn't really work well, or the patient's still having a lot of symptoms, then we would recommend doing something surgically. And thankfully now we have the Da Vinci robotic platform, so we're able to do a lot of these surgeries laparoscopically.
And again, I've been able to learn how much that just really helps the healing process and helps the patient overall, right?
Absolutely.
I'm curious, when you do get a diagnosis like this, how many times do you have to have regular follow-ups? I mean, if a woman hears that she's got this, is it something to be down in the dumps about, or is it one of those that's...
No, it's usually so common, and most of the time it's benign. It's something we usually will just monitor at their annual exam if they're small and not causing symptoms. If they're larger, if they're causing a lot of heavy bleeding, if they have certain worrisome characteristics, then usually we'll recommend that we need to treat them.
And of course, I know one of the things that really you stand out is treating every person differently.
Absolutely.
And that's, I think, the biggest for your treatment. And this, of course, is no different, right?
Yes, absolutely. I mean, some patients come in and they're trying to get pregnant, and we're doing the evaluation, and we pick it up, and this is a fertility issue. So if that's the case, then we, usually will try to remove the fibroids for them if they're in a location that might cause problems with miscarriage. And sometimes, patients don't necessarily require treatment.
When you did bring up that most of the time they are benign, do you have cases where, if untreated, it can sometimes turn into cancer?
Usually, we see certain characteristics that are worrisome. They're growing very fast. They're causing so much bleeding that patients are requiring transfusions. Generally, the ones that are greater than 10 centimeters, those sorts of characteristics worry us. There are also certain characteristics on MRI that can tell us if this may be more worrisome and not a benign myoma. Those are called leiomyosarcomas that happen about 1 in 350 patients. So they're pretty rare, but it is possible, so we always keep an eye on it.
And in closing, what would you like to share with people that are watching at home? They're like, maybe I have the symptoms, but you know what, I'm not there yet. What would you want them to say as far as coming in and talking with someone?
If you're ever concerned or worried, it's always best to talk to your doctor about it, either just to ease your mind or to know what your options are. That's always the best way to make an informed decision, is to have that discussion with your doctor, and they'll tell you honestly, this is something you need to worry about, or this is something you really don't need to worry about.
Steph, it was so nice to meet you today.
Very
Thanks
nice
for
meeting you
coming
as
in.
well.
And if you have any questions about anything that we just discussed or anything else that falls under Women's Care Florida, of course, you can get in touch with them. There's the website you see on the screen.